right, okay. So we know that healthy, accessible school lunches can be a lifeline for food insecure, low-income families. And we also know from studies that it can improve childhood health outcomes, school attendance, and even test scores. So I would love to direct the first question to Crystal. Maybe you could talk a little bit about the exciting things that are happening with childhood nutrition to make sure that students are getting fed.
Absolutely. Well, I have to say one of the most exciting things that are happening in school meals right now is the movement around healthy school meals for all. And it really is a win-win for schools, for parents, and for kids. Healthy school meals for all is when schools offer breakfast and lunch to all kids at no charge. And it ensures that kids have the nutrition they need to focus and concentrate and learn in schools. It eases the household food budgets for parents. They can count on school breakfast and lunch 180 days out of the year, and it helps them make ends meet. And schools can count on having students who are well-nourished and ready to learn, and it reduces administrative work for the schools. During the pandemic, we had a trial run of healthy school meals for all, and a lot of people decided they did not want to go back to the way the school nutrition programs operated before. So we actually now have 9 states that have healthy school meals for all policies. We have 20 states that have legislation, or more than 20, to try and move in that direction. And actually, with the federal options and those state policies, we have 60% of schools offering free meals to all students. So I'm really proud at FRAC that FRAC helps lead the National Healthy School Meals for All Coalition, which is working to try and make this a reality nationwide, and then also working to protect the gains that we've made so that the current administration and Congress don't roll that back. And also really excited that we get to work with a lot of state campaigns who are leading these efforts, and it's a lot of really amazing organizations that are doing it. And the other thing, breakfast is an amazing option as well, but participation really does lag behind lunch. And so we are very focused on strategies to increase breakfast participation because the way that most schools operate the school breakfast program, they do it before the kids are even at school. So breakfast after the bell, breakfast in the classroom, grab-and-go breakfast are all really important strategies, and local communities can implement them. So even at a point in time when there are a lot of negative things happening with the federal nutrition programs, I am very heartened by what's happening with school meals.
And Dr. Erica Pan, there's so much that California is doing, from trying to ban ultra-processed foods by 2035 to now the universal school lunch program. Can you talk a little bit about what other innovative strategies the state is taking to feed their students?
Sure, I'm happy to talk a little bit more about one program we're really proud of called Farm to School. This has been championed by our first partner and working with our farms and our Department of Food and Agriculture. And these are grant programs that really connect local farmers with schools within a certain radius to provide that fresh farm to school, first school lunches, and also really provides hands-on education in the classroom to learn about agriculture and food and nutrition. And this is now in half of the schools in California.
It's amazing. That's really exciting. And Allie, I know you've worked a lot in California, in the Bay Area, with schools, with advocates. You are trying to educate people about the policies that they can take advantage of to make sure that their students get fed. Can you talk a little bit about what you're seeing with schools and what policies they can take advantage of?
Absolutely. Fortunately, out in California, we do have healthy school meals for all, right? But there are still places where schools can do a better job implementing these policies that we have in place. I think one of the really cool policies that California has had passed for the last 3 years is that schools, elementary schools in particular, can provide free breakfast to the siblings of low-income students. So 2, 3, 4-year-old siblings can be getting breakfast at schools, but we haven't seen a wide uptake of this particular policy. And I think that's a huge way for schools right now, particularly with SNAP cuts, to support our low-income families.
That's really exciting. Are there certain areas where you're seeing a lack of education in schools over, certain partnerships or things that they can do to feed their student? I know you were talking a little bit about how a lot of your work is educating on what else they can do.
Yeah, absolutely. I think it's tricky, right? Policy changes all the time. And there's a real need for us as public health advocates to sort of bridge the policy piece and what's going on the ground so that schools are able to better implement these policies. When I was doing my research, I found that about 30 to 50% of after-school programs and school lunch programs are not allowing kids to leave the school lunchroom with non-perishable foods, despite the fact that this has been encouraged by the USDA since 2014. And so I think there's a lot of work we can do on the ground to really bolster food security for students and families.
And now, you mentioned SNAP cuts. I mean, it's being projected that over 2 million people could lose their SNAP benefits over the next decade. What can you tell people about the work that's being done on the ground? Is there a way for families, for schools to sort of protect themselves from some of these consequences we're seeing on the federal level of spending cuts, of SNAP cuts?
It's a great question. I don't know that I have the answer to that, but I do think those solutions start locally in a lot of ways. And listening to parents, listening to community members, being responsive to their needs, and then working out solutions that meet the local population's needs is a really critical strategy to employ.
And I would love to jump in on the policy behind that, because when we think about the changes that they've made to the SNAP program last summer, there is a cascading impact that it would have on school meals, because if kids lose SNAP, which some of the decisions states might end up making because of the costs that are being shifted to states, if kids lose access to that, then they lose their direct connection to school meals, and that actually harms a lot of the work that we're doing around healthy school meals for all. So we really need to make sure that as states are implementing these new policies, that they're doing it in a way that they're putting the state funding in there to make sure that the SNAP program is able to continue to operate, that they do their best to mitigate the harm, and that they communicate clearly to families the changes that are making so that no one's surprised by it. So we actually have a lot of work to do over the next couple of years to make sure that we mitigate the harm from these SNAP cuts, and then also actually advocate to try and reverse them. SNAP is one of our strongest, it's our largest federal nutrition program. It combats hunger, it improves nutrition, and it lifts millions of people out of poverty, and we need to be strengthening and expanding that program, not contracting it.
And one more thought on this too, I think just thinking about all of this dependency in general and really strengthening our partnerships, really looking to the healthcare delivery and healthcare insurance side on these upstream impacts like food. And I know we'll have a later talk about food as medicine, but really trying to leverage and think about other partnerships is another area I think we all need to work on.
In California, what is being done, or what were you excited about seeing in school districts when it comes to trying to mitigate the impacts of these SNAP cuts?
I think we're still struggling with that, actually, to be really frank. And then the other really hard part is that it's not just the actual direct nutrition, but our nutrition education. So on the public health side, basically 95% of our nutrition and physical activity branch was funded by SNAP Ed, and now that has been completely decimated. So again, really trying to work with other partners to figure out how to make up for these big gaps that we're now seeing.
Contextualizing that, I mean, have you seen that level of cuts, that level of changes to something like school nutrition education programs, prior to this administration?
I don't think I have. I think the level of cuts to many different programs has really been unprecedented.
Yeah, I mean, they cut SNAP by about 20%, which is completely unprecedented, and the requirement for states to cover some of the benefits is a huge shift and incredibly problematic too, because there is a significant variation among the states with the resources that they have to put into the SNAP program, and then also the political will that they have as well. Is there anything that brings you, I guess, hope, conversations you're seeing with legislators, or ways that people are organizing on the ground, when you look at the after effects of these cuts?
I can take that one first. One of the schools I've been working with is expanding their backpack program in advance of these SNAP cuts, knowing that they're going to have a greater need for students to be able to take food home on the weekends. And so they got ahead of this. They're working with teachers to identify additional students and really working with the food pantry to make sure that families are food secure.
That's great. At least that's a point of hope. That's exciting. It looks like we are out of time, but thank you so much.
Thank you.